Infections can range from mild to serious. Often, infections may start off as mild, but if not noticed and left untreated, they can become very serious and can lead to death. A common example of this is a urinary tract infection, or UTI. If caught early, it can be easily treated with antibiotics, but if it goes on too long, it can progress to something called sepsis, where the infection has spread throughout the person's bloodstream. Sepsis is often called the silent killer, and chances are you've seen people who have had it or may have even lost someone close to you from it. I remember being in an ER when I was in medical school, and someone brought in a teenager with an intellectual disability who was confused, lethargic, and had a high fever. His pulse was rapid, his blood pressure was low. IV fluids were started as well as antibiotics, but it was too late. We lost him that day. I often wondered if Alex would still be with us if he had received treatment earlier. It's important to know the early signs of an infection so that you can notify someone, like a nurse, and help to get the person treated before it gets too serious. Some signs that people may show are not drinking or eating, unusual behaviors, becoming withdrawn or appearing sleepy. In this module, you'll learn about causes of infection, who's at risk for serious infections, what happens if they go untreated, and how you can help prevent them. You'll also learn what to do if you see signs of infection in a person whom you support. Let's get started.
Before we start this presentation, we will go over a couple of key words you may or may not already be familiar with. Knowing these words will help you better understand this presentation. Some other important words will be defined as they come up. Systemic means affecting or involving the entire body. A microorganism is a small, living plant or animal seen only with a microscope. There are two types of microorganisms we'll be dealing with in this course: bacteria and viruses. A pathogen is a microorganism that is harmful and can cause an infection. A reservoir is an environment where a microbe lives and grows. A host is a person at risk for an infection. Infection is an ever-present problem in all populations. In persons who already are medically challenged, it can become a death sentence quickly. There are two types of infection: local and systemic. Local infection only affects one part of the body, while systemic affects the entire body. An infection is caused by the overgrowth of any microorganism. We come into contact with microbes all the time, but they don't all make us sick. Some bacteria or germs live on or in our body all the time. To keep things easy, we're going to call all microbes germs. The most important thing for you to know and remember is how to recognize the early signs and symptoms of an infection and when to go into action. There is a chain of things that must be all hooked together for an infection to occur. If there is a break anywhere in the chain, an infection will not actually occur. First, there must be a source of infection. The source of infection is the harmful germ or pathogen. If there is no pathogen, there will be no infection. Next, the germ must have a place to live and grow, also called a reservoir. It could be a wound, the urinary tract, the eye, the skin, or any other area on or in the human body where they can live and multiply. Sometimes we carry around germs on or in our body, but they do not cause an infection until they are given or transmitted to someone else. The germ may also live normally in one part of our body, for instance, but if it gets transported to another part of the body, it causes an infection. Third, the germ must have a way to exit where it lives or grows. Just like we have a door to leave our home, the germ must have a door to leave its usual home. After it leaves its home, it must have a means of transportation. If a germ lives in the nose, for instance, and that is its normal home, it could catch a ride on a bit of mucus from a sneeze or cough, or just float in the air. It could pass to many other people or objects. After the germ leaves its reservoir, it must find a way to get into or onto another person or area of the body. This is the portal of entry. It must finally find a welcome host to allow it to start growing and multiplying again. This host must have risk factors to allow the germ to form an infection. If the germ lands on someone who is healthy, the germ may just use them as a means of transportation to someone else who is not healthy. For instance, a bacteria called E. coli is normally found in the large intestine. The E. coli here is the pathogen, and the large intestine is the reservoir. When a person has a bowel movement, E. coli rides along on the stool, being transported from the inside of the body, where it belongs, to the outside of the body, where it doesn't. If a person has poor wiping habits and E. coli gets swept up toward the opening to the urinary tract, it can decide to go live in the urinary tract for a while. In other words, it found a portal of entry. E. coli can decide that it likes living in the bladder, so it grows and multiplies. As it does this, it causes an infection. Unfortunately, bacteria can multiply very quickly. Even the healthiest persons are at risk for infection. Sadly, many of the persons served are very vulnerable to infection. They have many risk factors making them very good hosts for an infection. If a person is already ill with the disease, is elderly or very young, it can make them more likely to get an infection. The body may already be weakened and may not be able to fight off an invasion from another microorganism. In the very young, they haven't built up their own protection yet. The pathogen takes advantage of that weakened state to take root and grow. There may be other circumstances that weaken a body's natural ability to fight off or resist infection. Some of these circumstances are when a person gets overly tired, when the body is under physical or emotional stress, or when they generally are just in poor health. It is just not strong enough to keep an infection from occurring. Remember earlier we talked about all of the links in the chain being connected for an infection to happen? Well, we simply break the chain. There really is not much we can do with germs that normally live in or on our bodies as long as they're not causing us any problems. We have to have some bacteria. For instance, bacteria are necessary for breaking down our food in the digestive tract. Without that helpful bacteria, we wouldn't get the nutrients from the food we eat. Some prevention techniques will be discussed in the next section also. The first and best way to prevent all infection is with good hand washing. Washing the hands often and well is key. You should wash your hands by rubbing them vigorously together using soap and water. Let's go over how to properly wash your hands. First, wet your hands with water. Then add soap. Rub your hands together for 20 seconds. Rinse your hands thoroughly. Use a paper towel to turn off the water. Hand sanitizers are also very effective at killing germs if used appropriately. Some of the more common ways that germs travel from one place to another is through coughing and sneezing. If we touch a table or telephone where those germs have landed, we are now carrying them around on our hands. And we normally won't pick up just one germ, but hundreds, and then we share. Everything we touch after that is now contaminated with those same germs. We became the transportation system for the germs. Think of everything you touch in a day and how many others have also had contact with that same thing. How many hands have touched the handle of the shopping cart or that jug of milk you just picked out of the cooler at the store? Most stores now have sanitizing wipes to wipe the grocery cart handle before you start pushing the cart. This removes the germs from the handle that were left by the person before you. By removing those germs, there is nothing now for you to carry around. You have broken the chain. Not only can hand washing remove the reservoir, but just general cleanliness is important. Keeping the home and other environments clean is critical. During cold and flu season, you want to be sure and wipe down home surfaces and perform frequent hand washing. Disinfect toilets and showers. Rodents and insects also carry germs. Keeping the home clean can prevent germs being brought in by these creatures. The skin is the largest organ of the body, and it is also the #1 way to prevent germs from getting into the body. Keep it healthy. Good personal hygiene is important and hand washing is important. But washing your hands too often or using hand sanitizers can dry the skin out very quickly. This allows very small cracks in the skin which allow germs to find an easy opening. If the alcohol gel burns when you use it, you have a small area of open skin somewhere. If you have one of those little cuts, not only can you spread your germs, but you now have an easy opening to allow germs into your body. Use plenty of lotion after washing your hands to keep skin soft and elastic. You can also spread germs in many other ways. Blood and bodily fluids may carry germs. Always follow standard precautions when dealing with these substances. Wear gloves if you think you might come into contact with blood or any other type of body fluid. Put dirty dressings in plastic bags to prevent someone coming into contact with them. Encourage sexually active individuals to wear condoms for protection. More ways to spread infection are through contaminated food. Anyone who is ill should not be preparing food. Any staff with diarrhea in particular should not be fixing meals. If persons have direct contact with each other, such as kissing and sharing personal care items like toothbrushes or eating or drinking after each other, they will pass their germs. Germs can be spread through unclean equipment or unsterile procedures. Putting a catheter into someone's bladder may introduce bacteria inside if sterile technique is not used. Stop and think about the last time the blood pressure cuff was cleaned or the nurse or doctor's stethoscope was wiped off. Being able to tell if a person has an infection depends on the type and location of the infection. Sometimes the symptoms a person tells you about or the signs you see may be from other causes. In vulnerable populations, often the first sign of an infection is confusion or a change in behavior. It might even be that they are very tired and sleep a lot or are difficult to wake up or make alert. The person may not want to eat or drink. Often we will see fever. When temperature rises, it also causes the heart rate and respiratory rate to increase. There is no set figure for what determines a fever. Some resources will say 2 degrees over baseline, which is whatever is usual for the person. Some will say over 100 degrees Fahrenheit. Whatever way you use to define fever, use it the same way with everyone. Using the baseline temperature, you must take regular temperatures to determine what the person's baseline is. This may be hard to do. It is easier to use a set number, but it is up to the person's doctor or nurse to decide what is a fever. It is important to indicate how you check the temperature. Did you put the thermometer under their tongue or under their arm? Did you use one that goes in the ear or that is placed against the forehead? The measurements may differ by 1 to 2 degrees depending on the method. It is not recommended to check a rectal temperature in an adult unless there is no other way. Harm can be done to the rectum. There may be contamination if that thermometer is then used to check temperature by mouth, and there is certainly little dignity in rectal temperatures. If a person has a wound that is infected, you may see the skin around the sore is very red. There's always a little redness around a fresh wound. There may also be clear fluid coming from the wound or a mixture of blood and clear fluid. That is the body's natural response to healing. With an infected wound, the skin may be very red. There may be green or yellow drainage. Increased drainage and the wound or drainage may have a foul odor. There may be red streaks following the blood vessels going back toward the heart away from the wound. This is a serious infection and must be treated immediately. Urinary tract infections are also very common. Fever may occur. A person may have the urge to urinate very often but go very small amounts each time. It may burn when they urinate. They might not be able to urinate at all. The urine may be tea-colored or you might see blood present. It takes very little blood to turn the urine red, so don't panic. The person may complain of back pain. You might notice a person rubbing at their genitals or crying when going to the bathroom. They may avoid urinating because of pain. Sometimes the urine will smell bad. The person may be confused and lethargic and have no other signs or symptoms. Preventing urinary tract infections is important. Keep people well hydrated and encourage them to go to the bathroom to urinate as soon as they get the urge. When assisting a female with personal hygiene tasks, always wipe them with tissue using a front-to-back motion. If a female is wiped with a back-to-front motion, it pulls the bad bacteria to the front, allowing it into the bladder. Pneumonia is another infection that is seen with vulnerable populations. It may be from germs or it may be from aspiration. Pneumonia is an infection in the lungs. Fever, cough, and coughing up green or yellow secretions or just general lack of energy may be as signs or symptoms. Some individuals have lung disease or they have a weak cough. They cannot bring up the normal lung secretions, so the germs stay in their lungs and multiply. Encouraging people to take deep breaths and cough frequently helps prevent pneumonias. The first signs and symptoms may be confusion and changes in behavior. Some people may not actually have an infection, but have a lot of germs that could cause an infection. These individuals are called carriers. That means they are not sick, but they are carrying around germs that can make other people sick or themselves sick in the right circumstances. But we have all these antibiotics. Why care if someone gets an infection? We can treat it, can't we? Well, yes and no. Germs are getting smarter and smarter and are growing into what we often call superbugs. That means these germs learned how to be better and beat the antibiotics. So these superbugs have few, if any, antibiotics that work against them. Also, antibiotics do not work against a virus, and a virus can transform itself very easily and quickly, more quickly than bacteria. That is why the flu vaccine changes every year. You still have flu A, and flu B, and flu C, but now there are multiple variations of them. New strains of flu are always arriving on the scene. Bird flu and swine flu killed many people before a vaccine was developed. Deaths from flu illnesses would be drastically reduced if everyone would get the flu vaccine every year. And if an infection itself wasn't bad enough, a person can develop sepsis or septic shock as a result of an infection. Sepsis is a life-threatening condition in which the body is fighting a severe infection that has spread via the bloodstream. If a person has a bladder infection and instead of getting better or just staying in the urinary tract, it gets into the bloodstream. This is very bad. Now, those germs that found a happy little home in the bladder have found a bigger mansion in the whole body. They can invade and infect all the organs in the body because the blood feeds every organ, every tissue, and every tiny corner of our bodies. When the organs get so sick from the infection, they slow down or stop working. If the kidneys and the liver don't work, there is a buildup of toxins in the blood. This basically poisons the body, and the person dies. Blood pressure drops, the heart isn't able to work effectively, and the person dies. The most important thing is to recognize those little changes in your individuals early and seek treatment. Preventable deaths from septic shock should not be happening. Sepsis and septic shock kill nearly 1 in 3 people who develop it. Closely observe and know your individuals. Note any changes in behavior, signs, or symptoms of illness or infection. Write down somewhere what you see in the person's behavior in your own words. Report observations of possible signs of infection to your medical manager at once. This could be the nurse or your supervisor. If no response from the medical manager within 2 hours and there are minimal symptoms or behavior changes, contact them again. If no return call, make an appointment with their primary care provider as soon as possible or take to urgent care. If there is no response from the medical manager and the person is having difficulty breathing, unconscious, a fever over 102, or less responsive than usual, call 911. When in doubt, send them out with a staff person who is familiar with them and the current situation. What you should take away from this course is that eliminating preventable death and further disability should be every direct care provider's goal. Sometimes it is not enough to simply observe your individuals and document what you see. It may also not be enough to just report. You must act. But you want to act on things that you have observed are not usual for the person you serve. As a direct care provider, it is your duty to know how to provide safe and adequate care for individuals you are responsible for. It is your duty to find out how that person generally behaves and what services are to be provided for or to them. You must seek this information out. You can find this information by questioning your supervisor, your peers, and reading their clinical and behavior records. The most important documents you should be very familiar with is the Individualized Service Plan and the Behavioral Support Plan. Observation is not a passive thing. It is an active thing. Observe the individual in your care. Use your training to gain understanding of what you are observing. Decide if what is happening with your individual is unusual, and if so, act. Sometimes this can be as simple as reporting something. These 3 things can make a difference and save lives. Observe, decide, act.
The information you've learned here can be very helpful to those around you. Remember to let someone know if you suspect that someone has an infection, and most certainly if you see someone showing early signs of sepsis, like fever, confusion, and weakness. It can mean the difference between life and death. Thank you for joining us.